and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Glucose readings now in smartphone with smart glucometers. Old diagnostics for checking blood glucose levels have been left far behind with the use of glucometers. A new compact glucometer kit nowadays being used as one of the smartest glucometers. The device can be directly connected to your phone through the jack and is compatible with both Android and an iOS software. The complete kit includes a smart glucometer device, lancets, glucometer test strips, a lancing pen, a waterproof pouch, and even a user guide. It's user-friendly and pretty much most used device. When all the devices are turning smart, even medical devices are getting innovated. It is capable of instantly transferring the readings of blood sugar levels to your smartphones and share it with doctors for online consultations. COVID variants remain hidden in the body. A new study reports a mesmerizing fact about how COVID-19 may have several variants of the virus hidden away from the immune system in different parts of the body. The study that has been published in the journal Nature Communications reports how the virus can evolve distinctly over the course of time in different cell types and adapt its immunity in the same infected host. The researchers have investigated the function of a tailor-made pocket in the SARS-CoV-2 spike protein in the infection cycle of the virus. Oral immunotherapy induces remission of peanut allergy in some young children. Peanut allergy has been known to affect about 2% of the children in the United States, or nearly 1.5 million individuals aged 17 years and younger. The risk of a life-threatening allergic reaction to accidentally eaten peanut is significant for these children, most of whom remain peanut allergic for life. The results of the IMPACT trial were published in the Lancet journal has found that giving peanut oral immunotherapy to highly allergic children in the aged 1 to 3 years safely desensitized most of them to peanut and even induced the remission of peanut allergy. The immunotherapy consisted of a daily oral dose of peanut flour for 2.5 years. Remission was defined as being able to eat 5 grams of peanut protein equivalent to 1.5 tablespoons of peanut butter without having an allergic reactions 6 months after completing the therapy. The youngest children and those who started the trial with lower levels of peanut-specific antibodies were most likely to achieve remission. Is migraine tied to complications in pregnancy? Women with migraine may have a higher risk of pregnancy complications like preterm delivery, gestational high blood pressure, and even preeclampsia, according to a preliminary study which is presented at the American Academy of Neurology's 74th annual meeting. The researchers also found that women with migraine with aura may have a somewhat higher risk of preeclampsia than women with migraine without an aura. Now, what are these auras? Auras are sensations that come before the headache, often as visual disturbances such as flashing lights. Preeclampsia involves high blood pressure with additional symptoms such as protein in the urine during pregnancy, which can threaten the life of both the mother and the baby. Roughly 20% of women of childbearing age experience migraine, but the impact of migraine on pregnancy outcomes, however, still needs further understanding. Short DAPT followed by Clopidogrel monotherapy no better than long-term DAPT. Patients with acute coronary syndrome are regarded as having a higher long-term risk of cardiovascular events after a percutaneous coronary intervention compared with the patients with the chronic coronary syndrome. Therefore, the recommended duration of the dual antiplatelet therapy after percutaneous coronary intervention was longer in patients with acute coronary syndrome than in patients with chronic coronary syndrome. A study published in the JAMA Cardiology suggests that Clopidogrel monotherapy after 1 to 2 months of the dual antiplatelet therapy is no better than the standard 12 months of dual antiplatelet therapy among acute coronary syndrome patients with successful percutaneous coronary interventions. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.